Sometimes waiting for labor can really be a trial of patience, right? All you want to do is to finally deliver that baby, but nothing is happening in your body.
Right.
And so you might ask yourself, what's taking so long?
Yes. So in this video, we want to offer you several possible explanations as to why labor is not starting and what you can try in each situation. And then at the end of this video, we are also going to share with you our action plan that hopefully helps you avoid that you don't go into labor.
Yes, Nathalie is a pregnancy and birth consultant and TCM therapist.
And Matthias is a researcher and science geek, and on our channel we help expecting mummies naturally and science-based.
We're happy that you're watching this. So far, scientists have not yet fully understood what exactly causes labor to start. Some say it's the baby, others say it's the uterus. But what we do know for sure is that eventually some event triggers the release of labor hormones in your body, which lets you go into labor.
Yes. Now, before we even talk about the reasons why you don't go into labor, let us tell you that on average, a pregnancy lasts between 38 and 42 weeks. Everything within that range is considered normal.
Yes, and we say this because we see so many women who are only 37 or 38 weeks pregnant and they panic because they haven't felt any contractions so far. If that's you, please do not worry. For most women, week 37 and 38 is way too early to go into labor. So you might have to be a bit more patient.
Right. But then, of course, there are also women who have gone over their due date and nothing is happening.
Yeah.
So let's have a look at the possible reasons why you don't go into labor.
Whenever it's taking longer than you expect, the first thing that we would ask is, are you really sure it's taking longer? Because here's the problem. You would not believe how many women got the wrong expected due date.
Right.
And obviously, if you got your due date wrong, you might think you are 40 weeks pregnant, when in fact you are only, 39 weeks pregnant, for instance, right? So how can you get your due date right?
Well, of course, expected due dates are always just the best guess only, right? However, the most reliable method to calculate it is an ultrasound exam which is done in or before week 12 of your pregnancy. If they gave you a date based on an ultrasound exam that early, go with that one and with that one only, okay?
Yeah.
Sometimes they may give you a new expected due date based on a later ultrasound exam, but they are not reliable for reasons that we discussed in another video.
Yes, the same applies to the LMP approach. The LMP approach could produce a reliable date, yes, however, it is based on very strong assumptions about the length of your cycle. And so if you got the length of your cycle wrong, the LMP approach cannot produce a reliable date, right? So again, the first thing to do is check your expected due date, and the most reliable method to calculate it is an ultrasound exam in or before week 12.
Another possible reason why your body may be unable to go into labor is because either your baby is still very high in your pelvis or because the baby is in an unfavorable position. This can be the case, for example, when the baby is facing your front instead of your back, or if the position of the baby's head is awkward. For example, the baby is looking upwards.
Yes, but we are not saying that a woman cannot go into labor in such situations, because you sure can. However, there is a tendency for such women to have a harder time going into labor.
Right.
So if either your baby has not yet engaged or is not in an optimal position, please bear with us. We are going to tell you later what you can try.
Right. Before your cervix can dilate, which for the most part happens when you are in labor with strong contractions, it has to undergo some changes. Most importantly, it needs to soften.
Yeah.
But the problem is that no one can tell you for sure when this process, which is also called cervical ripening, is going to start. And when it happens very late in your pregnancy, it is likely that labor starts very late too.
Yes, so very often the problem is that the moment when a woman enters the pre-labor phase or even early labor, her cervix is still very thick and firm and it's not yet in a favorable position. And so the body just requires some time to work on those changes before it can send her into active labor, which is the phase of labor when you experience those strong contractions.
Yes. And that's one of the reasons why we keep telling you on our channel to help your body prepare the cervix for labor from week 37 onwards with the tools that are available.
Yeah.
And if you want to know which tools these are, please bear with us till the end of this video. Some experts like Penny Simpkin argue that another major reason why it can take longer for labor to start is when the cervix is scarred from a previous surgery. Because then the problem is often that the body finds it more difficult to soften the cervix due to the scar tissue.
Yes, however, the good news here is that it is normally only just a matter of time for your body to overcome that problem. So all you can do is really do just that, give your body more time.
Right.
Sometimes your body is more than ready to go into labor. You can literally feel that it's about to happen, but there's just something that seems to inhibit the release of labor hormones.
Right.
And there can be many reasons for that. Medications can be the reason, medical conditions can be the cause. Some studies also found that obese women with a body mass index of at least 30 find it more difficult to go into labor spontaneously. But we would say that the most common factor that can inhibit the release of labor hormones are stress hormones.
Yes. Now, you should know that when it comes to labor, not all stress is bad. In fact, stress hormones do play an important role in initiating the whole labor process.
Yeah.
However, there is also the kind of stress which can prevent labor from starting, and it can even shut down labor when it has already started. And that's often the case when fear or anger is involved.
Yes, and we really see this very often. Sometimes all that it takes is one of Nathalie's treatment to bring down stress levels, and that's it, they go into labor. Nathalie does not even need to address any labor-specific issues, right? Relaxation is all that it takes.
Right.
So if stress is a thing in your life, it might make sense to address that stress. Nathalie does this with the help of acupuncture and reflexology, but it could also be a massage treatment or meditation or yoga.
Yes. Or if it is fear, it might help to talk to a therapist. It really depends on your situation. And because of that, we teach lots of different techniques and tools to cope with both stress and anxiety in our childbirth class.
Sometimes it can happen that a woman is in pre-labor, but she's not aware of it. Actually, this happens very often because it can be very difficult to distinguish pre-labor contractions from Braxton Hicks contractions, right? And sometimes it can happen that that pre-labor phase takes a very long time. And according to experts, this is most likely to happen if the uterus contracts in an uncoordinated fashion so that the contractions are unable to open the cervix.
Yes, that too will normally resolve if you give your body more time and if you rest. Sleep can be particularly helpful here. Sometimes, however, if there is really no progress whatsoever for the longest time, an induction could be required.
Yes, still many experts agree that very often most causes that can delay the start of labor will eventually resolve by themselves if you give your body more time.
Right.
And that's great. However, the problem is that most doctors will tell you, hey, if you don't go into labor by date X, I'm going to induce you. But we really wish they wouldn't say such things, because what do such statements do to a woman? Well, they cause pressure, right?
Exactly. And that's something we clearly observe at my practice. If a woman was told that she has to go into labor by a certain date, it is even less likely to work. Because then we are back what we have discussed earlier. Stress hormones can inhibit labor hormones.
Yes. So in order to help women avoid, well, at least most of the scenarios that we discussed, and to help them overcome them, we normally do the following. So from week 35 onwards, we help the baby engage in the pelvis with the help of our 5 steps protocol, which we discuss in the video that pops up now.
But before we do that, it is important to make sure that the baby is in the right position for labor. So if the baby is not in a good position for labor, then please watch the video that pops up now.
Yes, and then from week 37 onwards, we start to prepare the cervix for labor in the hopes to speed up the whole cervical ripening process with the tools that we explain in the video that pops up now.
Right, and just that you know, these tools could also help you induce labor in case it is taking longer for you.
Yes, by the way, you can also find those video links in the description below this video. And of course, we show you lots of additional tools, treatments and techniques in our online childbirth class that you can find in the description below this video.
Right. That's it. If you have found this video helpful, we would be super grateful if you could leave us a like below this video.
Yes, and for more useful tips and tools on pregnancy-related topics, make sure to subscribe to our channel and to hit the bell.